Yes, we see everything. Yes.
Yes. Thank you very much. I am Sobia Shafaq Shah, and thank you very much for providing me this opportunity to talk on this very auspicious conference. My talk is in general about the mental health situation in developing countries and providing some insight from Pakistan. So basically, we all know that mental health, good mental health is very important, and it is a prerequisite for a good life. And in developed countries, this notion, this concept is accepted in a very well manner. But uh, again, the issue is this: still in the developing countries, in least developing countries, still a good mental health have not received so much attention. Good mental health can be defined as a state of well-being that allows individuals to cope with the normal stress of life and function productively. With the every passing day, our life have become so busy. We are to some extent addicted to technology. There is a very fast pace of life. So there is the causes of psychological stress and other anxieties have increased. But in developing countries, still the notion of good mental health is understudied, undervalued, and also it have not given a such priority that a masses, a general public think that it is a very core area, and then we should give a priority to that. Generally, when we are talking about the good mental health, then it cover all domains of our life. It provides us a meaning of life. It increases our mental health literacy. It also enables us that we have to shape our attitudes towards mental disorders, our self-perceptions and values, cognitive skills, academic, occupational performance, emotions, behavior, self-management strategies, social skills, family and significant relationships, physical health, and quality of life. So, even our this mental health cover the all important spheres of our life, but yet in a developing country, including Pakistan, a people or general public is not very much uh, mean very much not familiarized that how to improve their mental health. And so there is a very dire need that in Pakistan, other developing countries, a more focus should be placed on maintaining a good mental health. Because if a person will be mentally healthy, then he can be physically healthy. So all other aspects of the health begins from a good mental health. So my concern is this, that we should promote good mental health in developing country context. So certain areas I am going to, like in mental health issues in developing countries. So in developed countries, there is a more focus is placed on mental health issues, and proper facilities are available, proper guidance are available. But in developing countries, this approach is lacking. The main issue is ignorance towards recognizing and valuing the significance of good mental health. If people say, I have a mental issues, then people don't take it serious. Even sometimes it is considered as a social taboo that some people say that this is not a good thing to talk about. People will laugh at us, and then our my self-esteem will low down. So that's why it is a not considered as a priority due to lack of awareness and cultural, social, as well as economic consideration. Because from cultural, social perspective, developing countries vary. Like in Pakistan, we do have an economic issue. Our cultural scenario is different. Our social landscape is different. So that's why, I mean, it is very difficult that how we can, break this constraints, how we can bring this important issue at mass level, at general level, so every people should consider their good mental health as a priority. So when this sense will develop, then mean other parameters of good life can be achieved. Now, one of the important factor, mental health has always been an issue, but pandemic have greatly triggered that issue. Even though the era of COVID-19 have passed, we have restored to the normal life, but those who have gone through this pandemic, those who have lost their loved one, their family members, and still people are following mask wearing, social distancing. So still there is a negative impact of all those. The issue of social isolation, disruption in everyday life, and most importantly, false information that have severely impacted the mental health. And there is a lot of psychological issues have arise like anxiety, depression, panic. So even if there is a now there is a false information arise came from any source, so people become worried. So they they mentally get disturbed that maybe again that virus come again, and then again our normal life halted. So when such type of uncertainty, people, I will say that people here still in Pakistan here not have come out of the shock of this COVID-19 pandemic. And whenever they listen anything news and even any misinformation, that they become disturbed. That again, that will come again. Our normal life will disturb again. We will have a financial issue, economic issue, health issue. So that's why it is important that we have to promote good mental health as an essential care component for population that have been victim of emergencies and disaster before, during, and after the event. Mental health in Pakistan, so with the passage of time, the incidence and prevalence have both increased tremendously in the background. When we are talking about the Pakistan, because of the insecurity, issues of terrorism, economic problems, political uncertainty, unemployment, disruption of the social fabric, all these have collectively have exert a negative impact on mental health. So one of the main reasons is because there is a lack of awareness. Undoubtedly, the certain percentage of Pakistani population is illiterate, and they don't have a proper understanding about the mental health. What is the mental health? If something happened, then what they have to do. But still, with the emergence of good work of media, now people know, but again, that level of understanding is not there. There are many other things which can be done to improve the mental health of the people in the area of social environment, economic environment, and political harmony. But the important subject for debate is that how far we are in the area of education to educate people about their significance, how we can serve them if they have any mental disorder, mental issue, and empirical research that could have direct impact on the population. Pakistan got independence in 1947 and till now, 2022, almost 17 years have passed. And many other countries with the same age have done wonder in overall keep up of health sector, healthcare, and especially the mental health. But Pakistan, due to multiple reasons, is unable to achieve that desired progress. In my, whatever my experience, the major challenges that in Pakistan we do have about promoting good mental health is about a lack of awareness, and that could be attributed that we do have a certain percentage of our population is literate, so they don't have a basic concept of mental health, and even they are suffering from mental health, but they are unable to recognize those issues. Our social, cultural, and economic constraint. Like other developing countries, sometimes in our country, to talk about mental issues, to talk about mental disorder is termed as like a social taboo, and people reluctant to talk about the issue. Even they are going through those pain, but they are reluctant to talk about this issue. Then there is a lack of qualified and professionals. We do have a very limited qualified psychiatrists who can provide, a good and suitable, treatment. We have a lack of adequate resources. And one of the important issue we don't have a adequate empirical research that is conducted in our own local setting, within our own environment. So that could provide us a more relevant findings. Migration of local psychiatrists, specialists abroad, that also creates one aspect of brain drain. We don't have a more relevant qualified people who wants to stay in the country and wants to serve the country. High prices of medicines. Here, economically, we are not very sound. So that's why, people sometimes, even though they recognize their issue, they consult the psychiatrist, but again, they are unable to afford the medicine. Then lack of government support. Governments do not have more rehabilitation centers and those hospitals where general people can go, can get their proper arrangement and all this. So these are the major challenges. Because of this, mental health, we can't say the priority in here. Then, what would be my suggestion, recommendation? So, basic thing is this: when we are saying that mental issues are the issue, mental health issues are the serious concern. So, first of all, we have to increase the awareness. Once people will realize that they are having a problem, then they will raise up to solve them. So the first factor that we have to develop a mass awareness program, a mass good health, mental health awareness program. So everybody knows about the significance, about the value of a good mental health and how it is necessary to keep it at their priority. Availability of adequate resources. Mean what are the resources needed, programs, and then like park, other physical activities that are needed to have someone with a good mental health. More empirical research should be encouraged. I mean, more research should be conducted within the local context, within the local circumstances. So those findings could be more relatable. There should be opening of more rehabilitation and recreational center to engage people in a more positive way. There should be a better incentive for mental health professionals. So they stay in their country and will be willing to serve the people. Conducive environment from all perspectives, from economic perspective, environmental perspective, social perspective, safe environment should be safe. So people should have a less uncertainty, less risk, so they could have a more better mental health. Government commitment is the most important because until and unless government will not take good mental health as their priority on their agenda, it would be difficult to implement all those things. So I think that government commitment is the most important factor. And with this, I'm going to end my presentation. I hope that that would be valuable to all of you.
Thanks a lot. It was very, very interesting, and it is very